when did your mom and dad first get sick?
We actually had my dad works in a hospital. He's a medical transporter, and my dad got sick on March 17th. That's when he started getting feverish and just pretty much fever. No sore throat, no none of that, just fever. My dad is also has allergic rhinitis, so we're like maybe because he's sneezing a little bit, we're like maybe he's just have allergies right now. So we kind of ignored it and gave him like not ignored it, but we gave him tea and the regular remedies. The 19th of March, we had to take him to the hospital. No, the doctor. He made an appointment to the doctor because on Wednesday, the 18th, his fever went up to 102. And this only the day after he started getting sick. When he went to his doctor, he turned him away. He said, I can't see you with what's going on right now. You can't come here. You have to go to the ER. Honestly, I feel like that's a bad idea because he's not like he's having shortness of breath. And if he goes to the ER and let's say he has the COVID-19, he's going to be endangering a lot of people's lives there. But we had no other choice. His own doctor for years turned him away. So we ended up going there. That same day, that's March 19th, he got admitted. And from then on, we just actually we were talking to my dad every day, maybe like 3 times a day. We will call him in FaceTime because we can't see him, we can't visit him, we can't do any of that. He went on cardiac arrest. I believe that's 21st. It's on a Monday. And when he went on a cardiac arrest that same day, that morning, we were still talking to him and he was completely fine. He was joking around. He has a little oxygen in him, and he even said, I don't even need this oxygen because I could breathe on my own. It's just they just put it to me because I need an optimal breathing. He was fine. He was joking around. He said he's so strong. He got this. That same day in the afternoon, he went on cardiac arrest, David. And we're all in shock because we were just talking to him. He was fine. He was breathing well. He's still going to the bathroom on his own. He's totally fine.
And Cheryl, was he tested for COVID at the
He was,
hospital?
he was tested for COVID at the hospital, but it took forever to get it back.
How many days did it take before
I
the
think
positive result came back?
the positive result came back 6 days. He was already in the ventilator.
By the time the results came back, he was already on the ventilator.
Ventilator, yes.
Wow. So he has the cardiac arrest, and then did he ever regain consciousness?
He had the cardiac arrest twice, and no, he was sedated, highly sedated. Um, my father in total, had a cardiac arrest of 7 times. He kept coming back, David. He kept coming back.
He went into cardiac arrest 7 times, they told you.
In total. Because
Wow.
the first time he went in cardiac arrest was that the day after, like the same day that we spoke to him. He went in cardiac arrest twice on that day. And the day that he passed away, he went on cardiac arrest 5 times that same night. Because he went cardiac arrest 3 times and he kept on coming back. And the last two was like the end of it. Because he called, like the doctor called us and they said, if they keep on doing the CPR on him, they will break his chest. And even if he survive it, he's gonna be vegetable and it's not a way to live. They're also endangering the life of their workers that works there. My dad works in that hospital, and I don't think he would want to endanger of his coworkers' lives for him.
Did he go to the same hospital where he worked?
Yeah,
Wow.
that's where he went. He passed away in the same hospital that he worked for 18 years.
Cheryl, you sent me a picture of your father's body in the room on FaceTime. Tell me how that call came about.
My dad passed away, and it's the toughest time for us because in the Filipino culture we value the death of your loved ones. We value our elderly in general. It's very hard, David, to even explain it. My dad is our hero, and that day when he passed away, we asked him if we could see him, and they said, yeah, you could see him, right? But when I came there, they had like security in the front of the hospital, and you need to be like taking temperature and all that stuff. But they know that I was exposed with my father. So they said that they don't advise me to go up there. First, because, you know, majority of the people that's already in the ICU already are cardiac, like are COVID patient. So they were like, I don't want you to endanger yourself there. But David were already there, and it's like I just want to see a glance of him, like at least say my farewell. So I went, and they said, like, they just pretty much honor my dad. They were like, he didn't die alone. Um, Everybody loved him in that hospital. Everybody was mourning when they found out. And then, like, the lady, Melanis, she's the patient experience. She said, if you want, I can FaceTime you to see your dad. And I'm like, I have no other choice. That's So we went, and she called me in FaceTime, and David, it's like, I wish I could have been there. I know they're saying that he didn't die alone, that everybody loved him, but he was there by himself. But I'm gonna be honest with you. When I saw him there, I felt the sense of peace. Because honestly, when I saw his body, I didn't cry. I was just like, that's my dad. And it was so hard for me to see because I was expecting to see him at least even just from that window. But they were like, oh, I was exposed to him, and we don't know. Like, I've been trying to get tested. That's another story for me because it's been so hard to get tested. And my dad, it was just so hard to see him like that. It's so hard to see him like that, but I made peace with it. I wish I could have hugged him at least, or I could have prayed for him right there. I didn't get a chance to do so, but it was already hard with my dad. It was very hard already.
Were you able to get tested for COVID?
I was I was not able to.
Still have not.
I been going to Bergen Community College ever since it opened. With my mother, in the beginning with my mother. The first 3 days that we went there, we got turned away because they're already in capacity. And then I called other places to get tested. I called C Caucus, I called other places, and they said, you need to get tested in the county that you live in. And I have a prescription that says, you know, patient need to be tested for COVID-19. I'm also a healthcare worker, I'm a frontliner, and still it was so hard to get tested.
What do you do for a living, Cheryl?
I work in a pharmacy in the quality assurance department, and we are not like patient care, but we're the one that sends, like the medications. I work in a pharmacy.
So did your mom start to feel symptoms before you took her to get tested, or did she have them after?
She was already. So my mom started having a fever the night that I took my dad to the ER. That same night, my mom had a fever of 102. And originally, we're like, okay, her immune system probably went down because, my mom was so worried about my father. She started having fever on that Thursday. And that Friday is when they opened the Bergen Community College testing center. And my mom and I woke up at 8 o'clock because it opens at 8 o'clock. We woke up at 8 o'clock. We got there by 9, and we waited online. We were in the car for a good 3.5 hours for them to say the testing today is done. Everybody has to go home. The next day we woke up at 7 o'clock in the morning to get there at 8, and the line was crazy. And the same thing within minutes actually that they opened, they said its capacity and the testing now. We went there 3 days straight, David. 3 days straight, and we got turned away. The earlier we go, it doesn't matter. We You have to be there like at 12 o'clock in the morning for you to be able to go in. And I was even wondering because my mom is also a healthcare worker. She's an assistant nurse, and we should be priority. That's what they said. We should be priority for this, like the first responder, healthcare workers. But we couldn't even talk to anybody about it to get tested. And my mom, I took her to the hospital that Monday because her blood pressure was going down. Her fever never went down. It was always like 101. The night before I took her to the hospital, her fever was 103.9. And she refused to go to the hospital. And when I asked her, why you don't want to go to the hospital, mom? I'm like, I know I can take care of you at home because I've been taking care of her at home, like making sure her vitals are good. Everything is like perfect. And she goes, she doesn't want to go to the hospital because she doesn't want to be alone. And I go, Ma, you're not going to be alone. We're going to be calling you all the time. Like, at least in the hospital, you will have, proper care. And she goes, yeah, but I don't want to be alone. She goes, I don't want to die alone. And I go, Ma, you're not going to die. Like, don't say that. I'm like, you're not going to die. Everything is going to be all right. Daddy's going to be okay. You're going to be okay. And she goes, you know what? Let me take Tylenol and see if the fever goes down. Tomorrow, if I'm still sick, we'll go. That's what she said. The next day, she still refused. But that's the day that my dad went to the ICU. That's when the day that my dad went to cardiac arrest. And she just started deteriorating after that. When she found out my dad went to cardiac arrest, my mom is just in a daze. Like, she wasn't eating. Her fever was just like fluctuating. Her oxygen level was going down. Her blood pressure was so low that night that I begged her. I literally begged her, David. I'm like, Ma, please. I don't want to be the one doing the code on you while I call 911 and they come here. I don't want that to be in my hands, Mom. I'm like, let's go. Your organs can fail because it's not pumping enough blood. I'm like, it's been 2 hours like this. And it took us an hour and a half to get her stuff ready. And when I dropped her off there, that was the last day I saw her. I was not even allowed to go in the ER with her to wait. So she was in the ER and I was in my car. While I was sick, I was also sick. I was in my car for 5 hours waiting for her to get admitted. And I was just there and I was praying. I was just kept praying for my dad. I kept praying for her. I even bargained to God. I was like, God, please, like, I'm sick too. Like, can you just take me instead of the two of them? I'm like, I love them so much. I don't know what I would do if it's the two of them. I was begging God for it. And then my mom, she called me that day. And she goes, can you just go home? She's like, I'm okay. I'm just gonna wait. Don't wait for me outside. It's so cold. You're just in the car. You're sick. You haven't slept. She goes, just go home. She's like, I'll be fine. But I didn't go home until she got admitted. I wanted to make sure she got admitted and that they're taking care of her. I'm sorry. And then just days after that, my dad passed away. My dad passed away literally exactly a week after he got admitted in the hospital.
Was your mom still conscious and aware when your dad died?
I had to tell her because my family, we have like a group chat, and one of my aunt put it in a group chat where she's part of, and she's still conscious. She still could see messages. So I was scared that she's gonna read it from a group chat, and like not coming from us. So even though we didn't want to tell her because we want her to be strong, I had to tell her myself. It was so hard to tell her because I know my mom and my dad, they're inseparable. And I know in my heart that when my mom finds out, she's gonna be so heartbroken and she's gonna stop fighting. I know it. And when I told her that day, I felt it. And the way I told her, it was like, Mom, I'm like, are you okay? And she's like, I'm fine. And she goes, my throat is hurting me so much. She goes, it hurts so much and I can't breathe. She goes. And I'm like, Ma, did you find out? Because, she's in the same hospital as my dad. And I thought they would have told her. And she's like, find out about what? I'm like, did you know already? And she goes, no, what is it? And I'm like, Daddy passed away. David, my mom didn't say anything, but I can hear all the machines. All the machines started like sounding like her blood pressure is going low, probably her oxygen levels probably going down. And I'm like, Mom, I'm like, we're here for you, okay? Like, you gotta stay strong. And then she's like, I can't breathe. She goes, I can't breathe anymore. And then she hang up. And then maybe like half an hour after that, she called me in the afternoon. And she goes to me, David, this is like the last conversation I had with her. And she called me and she goes, listen, I can't anymore. She goes, I can't breathe. My lungs is like burning. This was just, my lungs is burning. I can't breathe anymore. And she goes, make sure you get everything ready. She goes, get my 401k ready. Get all the paperwork's ready. She goes, and she goes, take care of your brother, okay? And you and your siblings gotta love each other. And she goes, I just can't do this anymore. And I remember I wasn't crying and I'm like, Mom, it's okay to grieve. It's okay to be sad. That's fine. We're all sad. I'm like, but please don't say this. Don't say this. You're gonna be fine. You're gonna get better. Please stay strong for us. And then she goes, no, I can't do this anymore. I can't breathe anymore. That's what she said. And she goes, don't put me on a tube. I don't want any tubes. And she goes, she has a DNR. And I have to look for it. I have to look for her DNR. And she kept on stressing it. I don't want to do it. I can't breathe anymore. Look for my DNR. David, that same night, my mom went in rapid response. The same day my dad died, she went in rapid response.
What does that mean?
That means that her vitals all went down and they had to revive her. But she has a DNR. So the doctor called me and told me that your mother, we found her on the floor. She most likely was going to the bathroom and she fell and we found her on the floor. So when we looked her vitals were so low, so they have to put a tubes on her. David, she didn't want it. She didn't want that. They called me because I was the first call, but I have like my brother and my sister here, and I have brother and sister in the Philippines. So I'm like, when they called me, I'm like, she doesn't want any tube. And the doctor said, do you want me to remove the tube and respect her last wishes? And I go, I can't decide that right now. I can't. It was the same night that my dad passed away. Like, what do you mean, right? I remember I called my siblings and I couldn't say anything. I was just crying. I was like, Mom. It took me a minute to say Mom went on rapid response and they put a tube on her. And we all know she doesn't want any tube. So my sister, she called the hospital and she was gonna tell them to remove the tube because to respect my mom's last wishes. But the doctor said if we remove the tube, she's gonna leave us too. We don't wanna we don't wanna play God. Remove the tube from her. She needs to at least fight, right? So we had like a meeting, like a siblings meeting, and we're like, we're not gonna remove it because we don't wanna put that burden on any of us. That we're the one who decided to remove the tube and just let Mom go. And my sister was like, I can't let Mom go. I can't. I just can't. So we were even joking around because we're like, oh, Mommy's not gonna, she's gonna go through this because she doesn't have a weak heart and she's gonna pass this virus, like for 4 days. That's what we're saying because she was just in a tube and she was no progress, no regress, just the same situation, like same situation every day, no progress, no regress. And we pray every day. I pray every day. I even talk to my dad. I'm like, Dad, I know you love Mom so much, but you guys are supposed to love your kids more than each other because, we're your kids. I'm like, please tell Mom not to go yet. And then we even talked to my mom. I'm like, Mom, I'm so sorry that we put the tube on you. But you're gonna have to find a way if you really wanna go with Dad. And she did. She did. She was also exactly a week in the hospital when she passed away. I just realized that today. My dad was there from Thursday to Thursday. My mom was there from Monday to Monday. It
In the
has
same hospital.
the same hospital. The same hospital.
And did your mom work at that hospital too?
No, she works in another hospital. She works in Newbridge in Paramus. But the only reason we took her there is because we're like, my dad is already there. And, we want to take her where my dad is. So it's just like one hospital. She originally wanted to be taken to Holy Name Hospital, but I'm like, with the amount of cases over there, I would not even like drive by there. My mom got tested too, but we didn't even get her result. She passed away already.
Have
We
the
never,
results have the results come in?
we haven't asked because when she passed away, we just shut down. All of us just shut down. Like sometimes I don't even know what day it is. How many days has been? Like I still wake up and I say, thinking they're still here. I could still call them the other day. I picked up my phone and called my mother because that's my daily routine. I call them all the time. We live in the same house, but it's like we don't see each other because we work so much that we we only get to see each other on each other's days off. But it's just so hard to like grasp the idea that within days they both passed away. With my dad, we understand a little bit because my dad, there were so many times he could have been taken away from us. He's a survivor, David. My dad has a heart condition that, like, very rarely that you get diagnosed by it, and he did. He survived it. He got diagnosed by it.
What was it?
He has a condition called ventricular fibrillation. It's
Yes.
very rare, very rare, and your heart quivers. That will cause you to go on rapid response. So he had a defibrillator actually put onto him, and my dad is a very strong man. Like when they told us that he came back 7 times, my dad fought. He thought he's invisible. That's the thing. He fought through this, and he never gave up. It was his heart that gave up. You know. That's why when I was talking to my mom, I'm like, Mom, my dad never gave up. He fought through this. Like, he could have at least fought for it too. But David, I don't know how it feels to be with somebody for 44 years. You know? I don't know how that feels. They were inseparable. So, I don't know how my mother feels when we told her that the only love of her life passed away. Because if we were already broken and hurt, we could just imagine her. It's her husband before us, you know? So in a way, I felt like she died of COVID, but she also died of broken heart. And she died in her worst nightmare when she said she's gonna be there alone. David, for days, I, I kept on blaming myself. I was like, maybe it would have been better if she was with us. I could have taken care of her. I know CPR. I know all of that. I went to nursing school and it's like I know I could have taken care of her, that she would have not been alone. But she ended up dying by herself. We couldn't even see her. And I think it was much better that we were not able to see her. Because she died like at night. She died at 7:30 at night. And I didn't get a call till like 8 o'clock. That's when the curfew here. Even as much as I want to go see her, I would not be able to see her because it's already curfew. And I wouldn't be able to see her anyway in the first place. But I cried all night. I didn't sleep at all. It's just
Lord.
I couldn't just grasp that everything that's happening. I'm still processing with my dad and then my mom. Like, I start questioning a lot of things. Like what could have been done differently. I start blaming everybody. I blame the hospital that my dad worked because I know he contracted that there. I blame the hospital for like not giving my dad the proper PPE because when my mom is in the hospital, she asks them, "What kind of PPE do you guys use when you transport patient?" And they said, gloves, only gloves and mask, not even a gown, nothing." Like I started thinking about that. Then I started thinking about my mom's like hospital too. She works in long-term care and they're not even allowing her to wear a mask. David, she got into a fight with the administrator because they ordered not to wear a mask because it creates a scare in their facility. I'm like, they're not providing you the mask. I provide them the mask. I told my parents to wear the mask because if the hospital is not providing, I would rather you protect yourself. And I thought
What facility did she work at?
she works in Newbridge Hospital in Paramus. It's a long-term care facility.
And what hospital were they at that your dad
It's
worked at?
Hackensack Meridian in Palisades. Hackensack Meridian Palisades Medical Center. That's in North Bergen.
Okay.
And it's just everything happened so quick.
Were you were you able to have a funeral?
No, that's another thing. My mom and my dad both got cremated. We had no service for them. We didn't even get to have a proper, just a service. We couldn't. Um, what we did was we just pretty much followed their body from the funeral home to the crematory service place, like the cemetery, and we couldn't even go in the cemetery. We were outside looking at that, little windows that they have, and we didn't even know what time they got cremated, you know, like we literally just park on the side of the cemetery where from far away you could see the building where they have the crematory service. And my sister and I, we couldn't see each other too because, I felt like I was still sick. My brother was sick. My brother and I lived together with my mom and my dad. And my sister lives with her husband and my nephew. But my nephew is asthmatic. So we couldn't even hug each other. Because honestly, David, I felt scared to be around people because of what had happened. Because what happened to my mom and my dad is anybody's worst nightmare. I don't wish this to my worst enemy at all. I don't wish this upon anybody. And when they got cremated, we couldn't even hug each other because we just FaceTime and then we prayed through FaceTime. That's how we had their service. We are there. We waited until we saw the car drop off their body, and then we prayed, and that's how we got to honor them. Both of them is the same exact thing, only like 4 days apart.
Were the So they were both cremated together?
They're 4 days apart.
4 days apart.
Yeah.
Okay. And were the cremations buried, or do you have them?
We are gonna put them in an urn, and we have to bring them back to the Philippines because that's their wishes. So temporarily, because we can't even go back home, we had to leave it here at home with us. Just the thought of it, honestly, just really pains me, because it's already hard to go to sleep at night because my parents' room is literally like right on this wall by where I am, and their bed frame is right there, so I hear their beds when they're moving or when they're snoring. I hear it. But now it's like at night, it's so quiet, and everything just pains me. Like I can't even move out of this house because we can't even move out yet. Because of the whole COVID thing, there's no apartments we can move out or anything. So it's like I have to live with this till like this is over. Every day is like it gets heavier. People said things will get easier day by day, and I'm like, no, I feel like it's the opposite for me. Day by day, it gets harder for me.
Is it true that you guys had a family function that everyone was at, and maybe
Yes,
that's where people
yes,
got sick?
yes, that was actually that too. There was a family function that we had because my uncle just passed away too in the beginning of February in the Philippines. And we had a family function for him, like a little service there because we never got to see him and anything like that. So they call it the 40th death day. That's like a Catholic tradition. And this was when COVID was already here. It was in the beginning of February. Actually, this is Friday the 13th. And this was when COVID was like already like coming around and the government's getting serious, but not completely locked down yet. And that family function, there's about my uncle is also in the ICU actually until to this day. He's still fighting for his life. My uncle.
Oh.
So in that function, I had my mom, my dad, my uncle, my everybody in that function got sick, pretty much, except the
How
kids.
how many people?
There was about maybe, I'll say, a dozen of us.
Wow. Wow. Everybody
My
got sick.
my mom and my dad got sick. My mom, my dad, my uncle, they're all in the same hospital, and they're all was in the ICU.
And your uncle is still there, alive.
They're alive, fighting for his life. And he has a young kids, so I believe that he's fighting for his family. He
He's
has young
fighting for
kids, yeah.
them. Yeah.
He has young
Well,
kids, and he has not have any grandkids yet, so I
yeah.
really believe he's fighting for his life right now. But
Listen, go ahead. I'm sorry.
but also my aunt was I didn't know that my aunt was also taken in the hospital in Jersey City for suspected pneumonia. And I had my uncle and my other aunt that was home quarantined because they also had like suspected flu or pneumonia. And then my cousin, who he tested negative, said that he was having a fever for like a couple of days. But he works in like Quest Diagnostic. It's a lab, so they were doing like a test to test the COVID-19 test. So he volunteered for it, and he got it twice, and he was tested negative. But
Oh,
my brother and I, we got sick too. We were sick.
well, Cheryl, I thank you for telling us their story. It's hard to listen to, but it's important to hear. And I just want to again send you my sincerest condolences. There really are no other words.
Nope.
There are no other words. And I thank you for giving me this opportunity to tell their story.
Thank you. Thank you for. I just really want to advocate to this the importance of just being like quarantined and staying home because people are taking this so lightly. People are taking it so lightly, and they think that the government is just being too much or too extra about it. But when it hits home, you want to tell everybody about it. I try my best to say it every day. Even though I don't want to get out of bed, sometimes I will still record myself to tell everybody the importance of it, to staying home, to contain this virus, to not let it like go higher than it is. It just keeps getting higher, you know?
Well, and that's what I commit to you. I commit to you that we will share every bit of the story, every 38 and 47 seconds so far. I will share with everyone.
Thank,
Um, I don't understand why some people don't get it, and that's why we're telling these stories. So
thank you.
thank you, Cheryl.
Thank you so much.
Thank you.
Take
God
care.
bless you.
You too.
God bless you.
You too.